Can food which is meant to give essential nutrition and energy to the human body also be a source of disease transmission? Can proper food hygiene and safe preparation practice matter? What would be the scientific reasoning behind this phenomenon? Before we start this video, hit that subscribe button, show some love and press like, share with family and friends, and comment below. Your participation is appreciated. So without delay, let us begin. Sit back and enjoy. A parasite is an organism that lives on or in a host and gets its food from or at the expense of its host. Parasites can cause disease in humans. Some parasitic diseases are easily treated and some are not. Tinea in the Greek language is ribbon, bandage, or stripe. The types of parasites that we will look into are 1. Tanni, Solium. 2. Tanni, Saginatus. 3. Echinococcus, granulosus. 4. Diphyllobothrium, latum. Human tinniasis is a parasitic infection caused by 3 tapeworm species, T. saginata, known as the beef tapeworm, T. solium, pork tapeworm. Humans are the only hosts for these Tinea tapeworms. Humans pass the tapeworm segments and/or eggs in feces and contaminate the soil in areas where sanitation is poor. Tinea eggs can survive in a moist environment and remain infective for days to months. Cows and pigs become infected after feeding in areas that are contaminated with Tinea eggs from human feces. Once inside the cow or pig, the Tinea eggs hatch in the animal's intestine and migrate to striated muscle to develop into cysticerci, causing a disease known as cysticercosis. Cysticerci can survive for several years in animal muscle. Humans become infected with tapeworms when they eat raw or undercooked beef or pork containing infective cysticerci. Once inside humans, Tinea cysticerci migrate to the small intestine and mature to adult tapeworms, which produce segments and eggs that are passed in feces. Tinea solium tapeworm infections can lead to cysticercosis, which is a disease that can cause seizures, so it is important to seek treatment. As for Tinea saginata, cattle are intermediate hosts. Humans are infected by eating cysticerci, larval form. In raw or undercooked beef, the larvae mature in about 2 months to adult worms that can live for several years. Usually, only 1 or 2 adult worms are present. Adult T. saginata tapeworms are usually 4 to 12 meters in length but can be as long as 25 meters. T. saginata infection occurs worldwide but especially in cattle-raising regions of the tropics and subtropics in Africa, the Middle East, Eastern Europe, Mexico, and South America. Infection is uncommon in U.S. cattle and is monitored by federal inspection. Patients may be asymptomatic or have mild digestive symptoms including epigastric discomfort, nausea, flatulence, diarrhea, or hunger pains. Passage of a motile segment, proglottid, often brings an otherwise asymptomatic patient to medical attention. T. solium life cycle. T. saginatus life cycle. E. granulosis life cycle. E. granulosis. Human echinococcosis, hydatidosis, or hydatid disease, is caused by the larval stages of cestodes, tapeworms, of the genus Echinococcus. Echinococcus granulosis, sensu lato, causes cystic echinococcosis and is the form most frequently encountered. Persons with cystic echinococcosis often remain asymptomatic until hydatid cysts containing the larval parasites grow large enough to cause discomfort, pain, nausea, and vomiting. The cysts grow over the course of several years before reaching maturity, and the rate at which symptoms appear typically depends on the location of the cyst. The cysts are mainly found in the liver and lungs but can also appear in the spleen, kidneys, heart, bone, and central nervous system, including the brain and eyes. Cyst rupture is most frequently caused by trauma and may cause mild to severe anaphylactic reactions, even death, as a result of the release of cystic fluid. D. latum. Diphyllobothrium latum and related species, the fish or broad tapeworm, the largest tapeworms that can infect people, can grow up to 30 feet long. While most infections are asymptomatic, complications include intestinal obstruction and gall-bladder disease caused by migration of proglottids. Diagnosis is made by the identification of eggs or segments of the tapeworm in a stool sample with a microscope. Safe and effective medications are available to treat Diphyllobothrium. Infections are acquired by eating raw or undercooked fish. Usually from the Northern Hemisphere, Europe, newly independent states of the former Soviet Union, North America, Asia, but cases have also been reported in Uganda and Chile. fish infected with Diphyllobothrium larvae may be transported to and consumed in any area of the world. The solution is adequately freezing or cooking fish will kill the parasite. Effects of the parasites on the host are mechanical, nutritive and toxo-allergic. Therefore the answer to our first question would be yes. Food can be a source of disease transmission. A variety of bacteria, viruses, and parasites transmitted through food and water can cause disease. The severity and duration of the disease vary considerably. NIPH 2016a, Caparud 2015. Does proper food hygiene and safe preparation practice matter? Yes, this is an essential part of keeping our food safety and hygiene. If followed correctly, will benefit you in the long run. Always washing your hands with warm water and soap for 20 seconds before and after handling food. Don't cross-contaminate. Keep raw meat, poultry, fish, and their juices away from other food. After cutting raw meats, wash the cutting board, utensils, and countertops with hot, soapy water. Meat should be cooked well enough in order to keep these parasites at bay. So as the saying goes, health is wealth. If you enjoyed this video, please give us a like.